Hi, this is Dr. Stacy Borkis, and on behalf of the entire CornerStone Chiropractic team, I would like to personally thank you for making time in your schedule to review some information that we know is incredibly important for you as you are continuing on your path to exceptional health. Where are you now? The majority of people spend most of their life right in the middle, the comfort zone. They feel like they're healthy. They write off aches and pains, stiffness, soreness, maybe even allergies or asthma to normal side effects of everyday life. Just because it's common doesn't mean this is normal, and I can assure you that is far from normal. What we find when people start to slide down toward the left side of the scale, experiencing more symptoms and needing medications, is that their body is starting to degenerate and age faster than it's meant to. This does not have to be the direction you're heading. In fact, a lot of people think you automatically head this direction as you age. Absolutely not true. Our goal as your doctors in the office is to go through and do a system of evaluations to find out exactly where are you, how well is your body functioning, and then start moving you over to the right, toward the area of health and wellness, where your body is functioning well. And even if you do get stiffness or soreness or illness, your body is able to fight. It's able to heal and repair the way it was designed. Wherever you are right now, our goal is to just take you one step further in that positive direction. We would love for 5 years from now, you to be able to say, I'm healthier today than I was 5 years ago. Not many people can do that, but we sure would like it to become a lot more common. Here's how the chiropractic model is very different than traditional medicine. We know as specialists of the nervous system that your brain and your body have a connection that has to be maintained at all times for your body to work well. There should be 100% communication in that system at all times. When that happens, your body functions well, your body functions with ease, just like the safety pin over on the right. When you're looking at that safety pin, you can see that there's a closed loop, your brain and your body communicating well without any interruption. When that happens, you experience health, and that's what we want for every one of you. When, however, there's less than 100% communication between the brain and the body, think of this like a kinked up garden hose and trying to get water through. In the chiropractic world, we call this subluxation. It simply means interference in that information transmission between the brain and the body. When that's present, the body will start to malfunction. That could be as simple as one cell not replicating properly, or as grand as entire body systems starting to shut down. When that happens, we call this a state of dis-ease. Think of this like a disconnect in that safety pin. There's an interference or a disconnection in the communication system that's not allowing your body to process and heal like it was designed to. This eventually leads to ill health. People don't very often know this until they start to get symptoms. Symptoms are very important. They're there for a reason. Symptoms are your body's way of alerting you that something is wrong. It's your body saying, make a change, do something differently, because right now, your health is headed in the wrong direction. Here's typically where pharmaceuticals come in, whether prescription or over-the-counter. The job of a medication is typically to get rid of the symptom. In chiropractic, our focus is vastly different. We want to address the cause. We want to find the reason your body's not healing and then restore that natural healing ability. In chiropractic, our focus is the nervous system. Identify subluxation, that interference in the body's ability to communicate, and correct subluxation with a very specific scientific chiropractic adjustment. We call this the wellness model. Our goal is proactive health enhancement, continually moving you to a higher and higher level of health. Our focus is adjusting the cause. Get to the root problem and fix it so you can go on living a healthy life. Your body is designed to be extraordinary. It's designed to heal itself. We help you be your best by restoring the communication pathway between you and your body. It's simple. It's called chiropractic. So what causes subluxation? Pretty simple. Subluxation is your body's response to an overwhelming amount of stress that it can no longer adapt to. Those stressors can show up from 3 different areas of our life. Taking a look at this picture, you can understand how you experience stressors in all 3 of these categories. The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. Thomas Edison. So the goal of chiropractic care is to lead you to optimal health in the most natural and safe way possible. No drugs, no medications, no chemicals. Instead of treating symptoms, our approach aims to correct their cause. Through those very specific and scientific chiropractic adjustments, we correct those subluxations to help restore your body's ability to function at as close to 100% as your body's capable of. Chiropractic allows you to express health, vibrance, energy, even happiness. Simply put, chiropractic helps you be the very best you. You are your best doctor. The best doctor is the one inside of you. Chiropractic adjusts so it can allow the body to heal itself. So, those updated evaluations, very important so that we know that we're always giving you our best recommendations. When do we do them? If you've been under care for 90 days in our office, this is a very important point in time for us to get an update and make sure that things are going according to plan. At the 1-year mark, or after every 12 wellness visits, we'll also update these scans and oftentimes the x-rays as well. When we expect to see progress, then we want to monitor that progress in you to make sure that we're always giving you the best, most customized recommendations we can. If you just came in with a new health concern, we want to see how your body's adapting to that. And if you've just returned to care after an absence, welcome to our office or welcome back. It's very important for us to know exactly where you are right now so that we can take the right steps moving forward. We'd perform these updated nerve studies and oftentimes x-rays as well so that we can measure your progress or your current health status. We want to assess how well your care plan is working for you and evaluate the effects of stress on your health, especially when we know those stressors are constantly changing. This helps us to ensure that we're always giving you appropriate care plan recommendations or updates. What is it we're looking for? Quite simply, change. Of course, we would love to see that things improve overnight. Typically doesn't happen that way. So what we want to do is we want to make sure that with the care you're receiving, and maybe even with the changes you're making in lifestyle habits at home, that your body is adapting. In the long run, of course we want to see improvement, but right now, we just want to make sure that your body's listening. We do expect results. Take a look at this adult male who had insomnia and acid reflux. His first pulse wave profile shows that his energy levels were very low and his body was working in overdrive. After a period of time, you can see how his healing ability goes right into target. Here's an adult female who had chronic fatigue and fibromyalgia. You can see how even the mild pressure in her nerve system was changing and adapting, and how the severe level pressure in her middle spine has actually shifted and reduced. Great change. Here's a 3-year-old with chronic asthma and ear infections. We see these a lot in our office. As you can see, there's a major difference from his first scan to his second. This area where the nerves help control his lungs significantly improved, and if you look a little bit higher up, you'll also see that those nerves that go to the head and face, including the ears, also have a lot less nerve interference. This little 3-year-old is now experiencing no ear infections and has not had to take any asthma medications since his 3rd week of care. Here's a teenage football player with scoliosis and back pain. His medical doctor actually advised he quit football because they didn't know what to do for him. As you can see, his scan showed a significant imbalance, and over time, that imbalance was worked out after we continued to monitor his progress and adjust subluxation when present. He's now very happily back in football and playing without pain. Here's an adult female with migraines and depression. Her initial x-ray showed that her neck curve was actually reversed from normal, and after a period of time, significant improvement with the curve back to where it belonged. If you can imagine going from migraines on a daily basis for years to having one every few months, chiropractic care in this case truly changed her life. We expect results for you also, but we have to continue monitoring to make sure we're on the right track for that. Once we get your updated evaluation, we need to assess to make sure that you're on the right care plan. We figure out where exactly are you now, and how do we keep you moving to that period of wellness. We definitely don't want you stalling out in the comfort zone. Of course, we recommend you continue on regular care. And no, you certainly don't have to keep coming back, but we certainly think you should. Think of it like this. If you go to the dentist and they say, you know what, congratulations, everything looks great, no cavities. Does that mean you quit brushing your teeth? Or you've been really good at going to the gym for the last year, have the body you want, things are looking and feeling amazing. Does that mean you can quit? Or how about when you fill your car up with gas? You don't expect to drive it around for months without having to fill it up again, do you? Everything we do in life that is worth the result is something that we do as a habit. It's something that we integrate as part of our lifestyle. So what are your goals? At this point in time, if you've just restarted care or if you came in with a new problem, then we probably will need to see you more frequently until that's resolved. Once we get you to a point of stabilization though, now you have a new choice to make. Is your goal for maintenance? Wanting to preserve the progress you've made? In this case, most people can maintain their improvement with a simple 1 or 2 adjustments per month. If that's not good enough for you, if you want to go one step further and experience the most optimal levels of health that your body's capable of, these individuals typically select a plan between 2 and 4 times per month. To give you an example, every team member in our office, every doctor, and our families are adjusted on a weekly basis. We would never recommend something to you that we don't do ourselves. So what we do now when you've reached the point of maintenance or wellness care is we get you set up on a VIP plan. These VIP plans give you a 20% discount to help keep regular care affordable and something that you plan for. What we do is we schedule your auto payments to save you time. You don't have to stop at the desk after every visit. And we also pre-schedule you at the times and days that are most convenient for your schedule. We want this to fit in as part of your typical lifestyle so that you experience the best results. So we like to make it easy for you. Why sign up for VIP? Quite simply, because it keeps you on track. We don't want you to slide backwards. If you wait and call when you need it, it's already too late. We definitely don't want you doing that. We want you to reap the benefits of everything you've worked hard for and take it one step further. Getting on a VIP plan helps to keep you on track and allows you the best chance at all the side effects. Yep, there are side effects for chiropractic too. Take a closer look. Tell your friends and family immediately if you happen to notice increased energy, decreased stress levels, more restful sleep, improved concentration. How about a better immune system? All of these are side effects of chiropractic. Who wouldn't want that? If you have kids at home that have not yet been checked, please talk to us about that right away today. We honestly believe that the only reason you wouldn't have had your child in to get checked is because we have not done our jobs explaining how very important it is and how much higher level health they can experience when their little bodies are free from subluxation as well. We want you to know that the greatest compliment you could ever give us is the referral of your friends and loved ones. We appreciate the trust that you have in us, and we know it takes a lot of trust to recommend our office to others. Thank you for making those referrals because it allows us to serve our purpose of taking even better care of our community. Thank you for taking the time today. Your doctor will be in very shortly to review your results and your updated care plan recommendations. Have an amazing day.